First trimester diagnosis of open neural tube defects has been quite an active area in the literature recently, with several publications describing new signs. This talk this afternoon will be divided into 5 sections: an overall introduction, the detection rates of spina bifida 11 to 13 weeks, an overview of the 12 markers with specific emphasis on the new marker which we've described recently for spina bifida detection in the first trimester, and then finishing up with some summary and comments. Universally, it's an abnormality, a major abnormality, which patients are seeking early first trimester diagnosis. It's an abnormality, however, where in the last 20 years it's been elusive to first trimester diagnosis, and the signs upon which we rely in the mid trimester, namely the banana-shaped cerebellum and lemon-shaped head, are not evident at 11 to 14 weeks, which explains in part why the diagnosis is so difficult. There have been a number of key publications which have appeared in the world literature recently describing new signs, and I would like to share with you this afternoon a sign which we believe may contribute to the diagnosis. But let's take a step back and ask the question, what is the detection rate of spina bifida at 11 to 14 weeks on current data? From the King's College, published in Prenatal Diagnosis in 2011, there were 44,856 patients screened via first trimester scan. There were 21 patients with spina bifida, and 3 of these were identified yielding a detection rate of 14%. A low detection rate in stark contrast to that much higher detection rate, where 18 out of 18 were identified 100% at 18 to 20 weeks. And an older study, a population screening study of 39,573 patients, in which there were 11 cases of spina bifida, 1 was identified at 11 to 13 weeks, giving a detection rate of 9%, again in stark contrast to a much higher detection rate at the mid-trimester. So an overview of the 12 sonographic markers which have been identified. If we go back in time to 1992 to 2002, it was a time when in the early 90s when high resolution was moving into the first trimester and identifying major fetal malformation, and there were 9 cases reported, a small number over this decade. And there were initial reports of 2 cases of a banana-shaped cerebellum from Bloomfield in 1992, and a further repeat of the study in 2000, and the lemon-shaped head, the classic mid-trimester features. But this work has not been replicated in the subsequent literature, and it's for most of these cases, it's likely at the very end of the first trimester, entering the second trimester, that you might see these signs. Ville and Buisson reported in 2002 parallelism of the cerebral peduncles, straightening of the metencephalon, and a narrow BPD, which we'll come back to later. With respect to the axial view of the parallelism of the cerebral peduncles, this is an axial section through the fetal head showing the aqueduct of Sylvius, and this here is the parallelism of the cerebral peduncles. We then had 7 years of quiescence, where no reports were identified with any new markers of spina bifida, until 2009. Rabin Chawi reported on the absence of the intracranial translucency, or the absence or obliteration of the fourth ventricle, as a marker for first trimester spina bifida. And to go through this from a diagrammatic point of view, here is an image of the fetal brain on its sagittal section. This is the thalamus. The midbrain is this point here, or the mesencephalon, and this is the brain stem. The brain stem has echogenic borders, as marked by here and here, and then posterior to this is the fluid of the fourth ventricle, or the intracranial translucency. The brainstem itself also appears quite hypoechoic, so we shade that in as green as well. And then posterior to that is the echogenic border of the roof of the fourth ventricle. And posterior to that is the cisterna magna. So the overall appearance of the midbrain and brainstem not dissimilar from the femur, the head, greater trochanter, and shaft. In essence, what happens in spina bifida, this whole area of the brain is displaced posteriorly and inferiorly. The net effect of that is obliteration of the cisterna magna, obliteration of the fourth ventricle, with this process of herniation through the foramina magna with Arnold-Chiari malformation. So if we look at it and take an image of an ultrasound image and create an animated GIF of this, if we look on the left-hand side of the screen, this is a sagittal image through the fetal profile showing the herniation, posterior displacement, and inferior displacement of the brain. And we take the starting images as here, the thalamus, midbrain, brainstem. You see the fourth ventricle here in cisterna magna, and with the displacement, there's obliteration of the fourth ventricle and cisterna magna on this animated GIF, creating an artificial image of spina bifida. So let's go through the landmarks of this. This is the thalamus, the midbrain, the brainstem, the two echogenic borders, anterior and posterior border, the roof of the fourth ventricle, occipital bone, the two lines of the nuchal translucency, and the spaces are the brainstem, the fourth ventricle, cisterna magna, and nuchal translucency. So it's important to become familiar with these lines and spaces in understanding the sagittal anatomy towards detecting spina bifida in the first trimester. So if we go through this image here in the top right hand corner, this is a sagittal image through the fetal face showing the thalamus, the midbrain, brainstem, fourth ventricle, cisterna magna, and in this bottom right hand corner, fetus with spina bifida, sagittal image showing the thalamus, showing the midbrain and the brainstem. If you look posterior to the brainstem, there's no fourth ventricle and no cisterna magna on view in a fetus with spina bifida. Another example in the bottom left hand corner, sagittal image through the fetal profile, showing the midline structures, showing the thalamus, the midbrain, and here's the brainstem with obliteration of the cisterna magna and intracranial translucency. So looking across the globe, there was validation of the intracranial translucency, the absence of as a marker for spina bifida across several centres. For initially, Waldo Sepulveda reporting on the prospective evaluation reproducibility of the intracranial translucency in normal populations, followed by various ways of looking at the intracranial translucency by using 3D and semi-automated and manual measurements compared, intra and inter-operator reliability assessed, and then case reports and 3D assessment of sagittal versus axial images were compared. So across this period of time, it was a busy time where people were reporting across the globe and validating that the intracranial translucency was an obtainable measurement, and not only that, but it was seen in cases of spina bifida. Over this time, were there any limitations reported on this? The first report that raised question about the sensitivity of this was a report by Ido Solt, who looked retrospectively at 250 examinations in patients who had a nuchal translucency performed as part of Down syndrome screening, and scattered in those 250 were 5 spina bifidas. The 4 independent operators measured the intracranial translucency and established the normal range in retrospect. And in those 4 cases, spina bifida recorded a normal fourth ventricle, and the conclusion of the authors was it was a less robust screening tool of open spina bifida than previously thought. Subsequent to that, there were reports of the intracranial translucency as being present in cases of open spina bifida, and there were 3 independent case reports of a normal fourth ventricle in the setting of spina bifida on sagittal imaging. Following on from that, there were case series of Fong et al. Who reported 4 out of 8 open spina bifida were not identified by looking at the intracranial translucency. And then there was a case series from the original authors from Rabin noting that there were 2 cases out of 6 in a subsequent study where the intracranial translucency was absent, but in 4 others there was some fluid in the fourth ventricle noted on sagittal imaging. In the larger series of all in the White Journal in 2003, 52 cases of spina bifida, 16 of which were identified in the first trimester. 4 independent observers retrospectively looked at the images and reported a sensitivity of non-visualization of the intracranial translucency or fourth ventricle in the diagnosis of open spina bifida, ranging from 29% to 37% across the 4 independent observers. Again, significant limitations of this study. Firstly, they were not Fetal Medicine Foundation certified scanners, and looking back in retrospect, they were looking at images that were not performed for the purpose of looking at brain anatomy in the first trimester. One prospective study, though, which is worth noting, was a study that a group that were NT certified, 3 centres across Athens, who looked prospectively at the intracranial translucency, established a normal range over 1,330 patients scanned, and 3 spina bifidas were missed in this population, and they went back and reviewed the image, and they were convincing in these cases, taking this particular example of the midbrain and brainstem looking remarkably normal in a normal intracranial translucency. So what does all this mean? Well, firstly, failure to visualize the intracranial translucency of fourth ventricle is unquestionably a marker for open spina bifida. What we recognize, it appears that in some cases there is a normal fourth ventricle in cases of spina bifida, and therefore it's not in all cases that you will see obliteration. I think an important point to make is it's difficult in drawing any conclusions from some of this literature where images were taken. The images that were taken in the studies were not taken for the purpose of examining the posterior brain. They were taken for the purpose of looking at the nuclear translucency, and therefore have significant limitations. And therefore, the negative reports on the accuracy of IT really needs to be taken, understanding those limitations, taken on board, understanding those limitations. There is, at the end of it, insufficient data to draw at this point in time conclusions regarding the sensitivity and specificity of IT alone in population screening for open spina bifida. There is, however, I think, probably the most important take-home message, a learning curve in recognizing normal sagittal brain anatomy, including a normal intracranial translucency, and likewise there's a learning curve in identifying the changes that occur in sagittal imaging of the fourth ventricle with open spina bifida. With regard to ischemic first trimester practice guidelines in 2003, the intracranial translucency has been suggested as a marker, but as yet it is not a standard. Moving on from 2009, Lachman and colleagues report a reduction in the frontomaxillary facial angles. So if we look in this top right hand corner, fetus at 12 weeks of gestation with a normal brain anatomy with a normal angle of about 90 degrees. In the top left hand corner, a fetus with spina bifida, and measuring the angle in this fetus, in spina bifida it's approximately 10 degrees less than normals, and in 90% of cases with spina bifida the frontomaxillary facial angle falls below the 5th centile. A more powerful marker, though, I think, is the brainstem and the brainstem occipital diameter, reported also by the same author. And looking at this image, if we if we look at the diagram, what happens in spina bifida is as the brainstem displaces posteriorly, it enlarges, and the distance between the brainstem and the occipital bone decreases. So the concept was to measure the distance of the brainstem, or the width of the brainstem, and compare it as a ratio to the distance between the brainstem and the occipital bone. If it was equal or greater than 1, or equal to or greater than 1, it was a marker for spina bifida. And I think this is a useful marker, and really from a subjective screening point of view, just on imaging, what you're looking for is that widening or thickening of the brainstem in spina bifida. So if we start in the top left-hand corner, in a fetus with a normal brain anatomy, normal thalamus, midbrain, and the brainstem thickness in this case is normal, whereas in the bottom right-hand corner, if you look at the sagittal imaging on this brainstem, it really is quite a wide brainstem, and the distance between the brainstem and the occipital bone is reduced. In the bottom left-hand corner, similar appearances. In a different case, spina bifida, looking at this brainstem, it is really quite wide, and the distance between the brainstem and the occipital bone is reduced. So this is another valuable marker in the prediction or identification of spina bifida at 12 weeks, at 11 to 14 weeks. Subsequent to this, Kavallakis and Mongione in 2012 and 13 reported the importance of looking at the cisterna magna. It was presented nicely as Kavallakis as looking at the 3-line sign, the obliteration of the cisterna magna. And taking a normal case here and creating that animated GIF of the herniation with obliteration of the fourth ventricle. In spina bifida there are 3 lines. So if we look at the anterior border of the brainstem, the normal here on the right, the posterior border of the brainstem, the line that's missing is the choroid of the fourth ventricle. And the last line is the occipital bone. So in spina bifida there are 3 lines, whereas normal there are 4 lines. So it's a nice way of looking and checking for absence of the cisterna magna. Subsequent to that, in 2011, we reported on the midbrain displacement as a marker for spina bifida. So instead of looking at the posterior cranial fossa, if you go back to all of these studies, these were all looking at the posterior cranial fossa. This was a sign that was moving from the posterior cranial fossa to the midbrain more superiorly. And if we look at this image here in an axial section through a normal fetal brain at 12 weeks of gestation, there are 3 important sections. The first superiorly, showing the choroid, and the third ventricle here. Moving down to the next section is the midbrain, and this is an image we're all familiar with. We're wired to recognize the landmarks for the BPD. This is the thalamus, the cerebral peduncles, the first trimester, a striking box of fluid is the aqueduct of Sylvius. And then the third plane is moving inferiorly to looking at the posterior cranial fossa, and this echogenic tissue here is the roof or the choroid of the fourth ventricle here, and this fluid here is the fourth ventricle. So important to understand those 3 axial sections of examining a first trimester brain. So if we go through diagrammatically what happens in the spina bifida, this is a drawing of a axial section through the fetal head. This here is the cerebral peduncles. Anterior to that is the thalmi, and then a discrete structure, as I mentioned earlier, is the aqueduct of Sylvius. And what happens in spina bifida is the whole midbrain is displaced. So if we take the center of the brain, highlight this area, and what happens in spina bifida is that this whole area of the brain is displaced, sitting juxtaposed to the occiput. So to go through examples of this to show on, again, an animated GIF, if we go to the next page, this is an animated GIF showing on the right hand side what happens as you get posterior displacement of the midbrain and with obliteration of the aqueduct of Sylvius. And then a diagram, animated GIF on the left hand side, shows the narrowing of the BPD, the parallelism of the cerebral peduncles, the reduction in size of the aqueduct of Sylvius, but most importantly, the posterior displacement of the midbrain sitting juxtaposed to the occiput. So if we go through now an example of normal, this is an axial section through the fetal head showing the thalamus, the cerebral peduncles and aqueduct of Sylvius in a normal case, followed by a fetus with spina bifida on the right hand side. And you look in this case, here is the thalamus, cerebral peduncles, obliteration of the aqueduct of Sylvius with the midbrain sitting juxtaposed to the occiput. So if we go through these cases, starting here in the top right hand corner, an axial section through the fetal head, midbrain sitting juxtaposed to the occiput, obliteration or a reduction in the size of the aqueduct of Sylvius. And then the bottom right hand corner is a tiny little cystic lesion over the base of the spine, 12 weeks of gestation, compared to a normal here, axial section through the fetal head showing the midbrain positioned normally. In case number 2 is in May in 2009, an axial section through the fetal head showing the midbrain sitting juxtaposed to the occiput, and the bottom left hand corner a cystic lesion over the base of the spine in the fetus with a lumbar sacral spina bifida at 13 weeks of gestation. In the next image, this is October 2009, as a fetus, again this is around the time when the intracranial translucency was initially reported. A fetus with a normal fourth ventricle inferiorly, but coming up to the midbrain, we can see that the midbrain is displaced sitting juxtaposed to the occiput when compared to a normal side by side. In this case, when we went to look at the spine, we were unable to confirm the spinal lesion in this fetus at 12 weeks of gestation. And for that reason, we brought the patient back at 15 weeks of gestation, 3 weeks later, and then looking at all the typical features were present then of a banana-shaped cerebellum, obliteration of the cisterna magna, and the fetus had confirmed spina bifida. So by this time, by October 2009, we had recognized that the displacement of the midbrain was an important marker. And case number 4 was in March 2010, a fetus with a normal aqueduct in size, but displacement of the midbrain sitting juxtaposed to the occiput at 12 weeks of gestation. A 12-week normal scan for comparison side by side. In this same fetus, looking at the spine on coronal imaging, we could see a cystic lesion over the base of the spine, typical appearances of a meningomyelocele, a lumbar sacral in position. And in the bottom left-hand corner shows a surface rendered image showing the bleb over the base of the fetal spine. In this case was a twin pregnancy. In May of 2010, the diagnosis was missed at the 12-week scan, but when we went back and had a look at the images of this dichorionic twin pregnancy, we could see in the normal twin that the midbrain was positioned correctly. And in the co-twin with spina bifida, we could see that now familiar finding of the midbrain sitting juxtaposed to the occiput with a reduction in the size of the aqueduct of Sylvius. Case number 6, in February 2011, a transabdominal scan was hard going. The patient weighed 113 kilograms. The nuchal translucency was difficult to obtain transabdominally, no mind the cranial translucency. And a transvaginal scanning in the bottom right hand corner, we appreciate that there is that displacement of the midbrain sitting juxtaposed to the occiput when compared to a normal co-twin, when compared to a normal pregnancy side by side in the bottom left hand image. In the same patient, looking with VCI static on a 3D image, just accentuating the appearances of that midbrain displacement sitting juxtaposed to the occiput. And the bottom right hand corner shows 0.5 millimeters slices over the lumbar sacral spine, showing a separation of the transverse processes with a lumbar sacral spina bifida. On the surface rendered image, we could see that there was no meningocele, but rather this was a patient with Rashi's schisis. In case number 7, an axial section through the fetal brain showing displacement of the midbrain sitting juxtaposed to the occiput, a normal third ventricle in this fetus, but the striking finding of the displacement of the midbrain surface rendered imaging showed here another case of a Rashi schisis, and this is a number of weeks later compared to the previous case. Axial sections through a normal brain for comparison. The cases number 8 and 9, again similar appearances showing the midbrain displacement, and another one bottom left hand corner showing the midbrain displacement. So showing all cases with the central image here. This is an axial section through the fetal brain, and all of these playing one after the other, demonstrating that striking finding in all cases of midbrain displacement. And for comparison, in the center I put a normal image. The question was how do we actually objectively quantify the displacement of the midbrain in these cases? The measurement from the posterior border of the occiput of the aqueduct of Sylvius to the occiput was taken as the measurement which we felt would represent this sign. The patients were scans which there were prospectively, so there was no choroid on view, and that's an important point which we learned over that period of time, that obliquity could create the impression of the midbrain sitting juxtaposed to the occiput in normals, and it was important to have no choroid in view, important to have the aqueductus square and ensure that there was lateral symmetry, and then measure from the posterior border of the aqueduct of Sylvius to the occiput. So we adopted a scoring system and established across 457 patients a normal range of distance, and in these cases we're all in the triangles with the patients with spina bifida. For most scans which we performed around the 12-week mark, the lower limit of normal was 2.5 millimeters, and anything less than 2.5 millimeters where patients were mostly scanned around 12-13 weeks was the important measure that triggered looking closely at the fetal spine and for the other markers of spina bifida. In 2012, Loero reported on global reduction in all the CSF chambers, and I think this is a valuable sign. Both the lateral ventricles, third ventricles, aqueduct of Sylvius, which we've already mentioned, and the fourth ventricle, which we've mentioned by virtue of the intracranial translucency. But the lateral ventricles, looking at the area of the lateral ventricles, they're actually quite a striking structure at 12 weeks because there's plenty of fluid around the choroid. If we just repeat that image, this here is the lateral ventricle, plenty of fluid around the choroid. In contrast to what happens at the mid-trimester, where the lateral ventricles increase in size and hydrocephalus evolves, in the first trimester the brain has a shrunken appearance, and this is exactly how the authors described it, where the choroids fill the cranial cavity with minimal fluid surrounding the choroids. In the third ventricle, we've touched on this earlier, but in the third ventricle in spina bifida, this is a normal. In this case, in the bottom right hand corner, the third ventricle is obliterated, and we have seen this in some cases, but not in others. The aqueduct of Sylvius we've touched on, and then we finish up with the BPD. A reduction in the BPD has been reported initially in 2012 by Buisson and Ville. And then coming back to 2012, the same authors returned to looking at this marker, combining it with alpha-feta protein and beta-HCG, and noted that 50% of babies with fetuses with spina bifida had a BPD less than the 5th centile. Work that was repeated by Asma Khalil and colleagues, and Rabin Chawi. So I think this is not so much a diagnostic finding, but more from a screening context. If you find the BPD less than the 5th centile, that it should trigger consideration for looking for additional markers of spina bifida. So to summarize, if we take all the markers that have appeared in the last 3 years, I think they will change the face of the detection rates from a screening context of spina bifida. One way to look at it would be to divide it into primary and secondary findings. From primary findings is the striking posterior and inferior displacement with disappearance of the cisterna magna fourth ventricle and enlargement of the brainstem, and the axial section on the BPD measurement showing the displacement of the midbrain sitting juxtaposed to the occiput. And if we consider as the other markers as being secondary markers where there's a reduction of the frontomaxillary facial angle, lemon-shaped head, straightening of the metaencephalon, parallel cerebral peduncles, and the reduction of the CSF chambers with BPD, I think may be considered as secondary signs. So to finish, I'll leave with two images. One, a image of the findings of spina bifida at the mid-trimester scan, showing the typical banana-shaped cerebellum, obliteration of the cisterna magna, and features with spina bifida 12 weeks of gestation on axial imaging, showing that striking displacement of the midbrain sitting juxtaposed to the occiput. Thank you.